When you're facing homelessness, everything is 10 times harder to access. My name is Tiara. I'm 21 years old. I live in Houston, and I am a person who has experienced homelessness.
Hi, I'm Alex Polk. My pronouns are he, they. I live in Austin, Texas. I am 23, and my lived experience is mostly on my experience with homelessness as well as commercial sexual exploitation.
Hi, my name is Montoya Thomas. I am 25. I am in Houston, Texas, and the experience I have is in homelessness.
When I was homeless, I experienced limited access to healthcare. I was getting my healthcare through the Texas benefits, and I was only limited to women's exams and dental exams. So anything that was not just general healthcare, general physicals, anything outside of that, it became more and more difficult to get access to it.
When I was homeless, healthcare for me was honestly non-existent, aside from the care that I received when I would go to the emergency room when my medical issues got serious. For some background, I have severe chronic health conditions that need to be monitored by a primary care doctor or by a specialist, and that was just out of the question because I didn't receive health insurance or even know how to get it.
And so with me being homeless and everything, I had to eat whatever. And so it deteriorated my teeth because I'm already worried about what I'm going to eat next. And so I can't just cook a healthy meal at the moment. And so with that affects my teeth, then that affects my heart, that affects my health. And now I'm at more of a risk. The barriers I faced when trying to get the resources was constantly calling numerous numbers and not getting a direct answer.
So the barriers I faced when I experienced homelessness trying to access the healthcare was trying to get permission for these appointments because I was a minor at the time. I needed my mom to verify certain things. I needed her signature on certain things. They wanted to speak to her if we were over the phone, and they were saying like, okay, you can't just schedule this without your parent, or you can't come up to the appointment without your parents. Also, I needed access to transportation when I was trying to get to these appointments. And then it's like when you're homeless and you don't have that much money, or your money is limited, you really don't have that. You don't know like how to schedule the time that you're going to be available because you don't know where you're going to be. You don't know if you're going to be prepared.
Being trans and chronically ill while navigating the healthcare system is and was one of the biggest barriers I had faced. And it was to the point where discrimination was almost expected. I also never had health insurance before, and when I was homeless, I didn't even know where to start. If I had someone to guide me through the process of getting insurance or even understanding what insurance was, I would have been much better off.
The things that I wish I had access to as far as resources would be financial advice, because when I was homeless and I was transitioning to adulthood, I felt like I was missing certain life skills. So financial advice, helping applying with jobs, guidance with life skills, maybe even more information on hygiene, all of those things that usually your parents would teach you. Those were the things I felt like I needed.
It would have allowed me to sleep better at night and not worry. It would have helped me focus more on trying to get somewhere to live, find somewhere to live, and focus on my school studies peacefully. When it comes to our physical and mental health, it's very important because that impacts on how we participate in our day-to-day lives, and how well we do in school and work, and how we're able to think correctly. But if we are having health problems or we're not able to think clearly, that can impact on how well we do in life.